Hello friends, in this webinar we will discuss about the possible sources and the channels of transmission of infection in neonates. Before we discuss sources of infection, let us see this classification of neonatal sepsis. The sepsis is divided into two types based on age at onset. If the sepsis manifests at or before 72 hours of life, it is known as early onset sepsis, while that manifesting after 72 hours, the sepsis is known as late onset. This classification is very important as the two types of sepsis are supposed to have different sources, causative pathogens, clinical manifestation, the management as well as the outcomes. Here we describe where the infection comes from in early onset sepsis. You can see this figure, the bacteria from the rectum and the perineum of the mother ascends to her vaginal tract. The baby contracts infection while passing through the birth canal. Alternatively, the pathogens ascend to the amniotic cavity through the ruptured membrane and reach to the baby. Through the ingestion or aspiration, the bacteremia sets in and some of these bacteremic babies develop what is known as early onset sepsis. Therefore, the source of infection in early onset sepsis is often maternal genital tract and it transmits from the mother to the baby, a form of vertical transmission. Though the early onset sepsis can happen without any risk factor, it generally happens in the setting of a variety of maternal risk factors. These risk factors include rupture of membrane for more than 24 hours, spontaneous preterm labor, presence of choriamnionitis. The choriamnionitis has been defined as presence of maternal fever of more than 100.4 degree Fahrenheit and any two of the factors, namely maternal tachycardia, fetal tachycardia, foul smelling liquor, uterine tenderness and maternal leukocytosis defined as total leukocyte count of more than 15,000 cells per cubic mm. The other risk factors include prolonged labor defined as duration of labor for more than 24 hours, unclean or multiple PV examination. Some studies have identified maternal UTI and diarrhea as the risk factors, but these risk factors have not been consistently reported as the important ones and therefore, we have not included them in the list. Now, let us look at late onset sepsis. The late onset sepsis in hospitalized neonate is known as healthcare associated infection or HAI. As the name indicates, HAI occur during the process of providing health care. A variety of risk factors increase the probability of occurrence of HAI. The most important one is the lack of adequate hand hygiene by the care providers. The hands of the providers get colonized with resistant pathogens in the process of caregiving, and if the proper hand hygiene is not practiced, the contaminated hands can transmit pathogens to the neonates under their care. The other risk factors include too many procedures, investigations, suboptimal asepsis routines during the procedures, infection occurring during ventilation, particularly during endotracheal suction, overcrowding in the unit and low nurse patient ratio, lack of breast milk feeding, use of IV fluids and use of unnecessary drugs and even antibiotics. The infection in late onset sepsis therefore transmits from the environment to the neonate and this is known as horizontal transmission. The late onset sepsis can occur in the homes as well as in the community, and if it occurs in the community, it is known as community acquired infection. The source of this type of infection is again the environment, and the infection passes through horizontal transmission of pathogen, and the risk factors include lack of hygienic environment and the hygienic practices in the homes or the community. The other risk factors are occurrence of superficial infections such as umbilical sepsis or skin pustules and lack of breastfeeding. This slide has a very important message. While the early and late onset sepsis are pretty distinct entities in the developed nations, but that is not the case in the developing countries. In early onset sepsis, the bacterial pathogens and their antimicrobial resistance, clinical manifestations and outcomes quite resemble those of late onset sepsis in developing countries. This suggests that early onset sepsis in developing countries may be transmitted through horizontal transmission due to unhygienic practices during birth, resuscitation and first few hours of life, a pathogenesis similar to that of late onset sepsis. Alternatively, it is also possible that early onset sepsis is still transmitted through vertical transmission and the maternal genital tract is colonized with late onset type pathogens. Prevention of early onset sepsis therefore involves preventing and managing maternal risk factors as outlined in previous slides, as well as providing hygienic care during birthing and resuscitation, as well as during early few hours of birth. Late onset sepsis could be prevented by good NICU practices in the hospitals and hygienic practices in the homes. We have a separate webinar on this issue. Breast milk feeding would prevent both early as well as late onset sepsis. Following are the key messages of this webinar. The neonates suffer from two types of sepsis, namely early onset and late onset depending on the age of the neonate at the onset of sepsis. The source of infection in early onset sepsis is the maternal genital tract, and there is vertical transmission of pathogens from the mother to the baby. The late onset sepsis on the other hand is acquired through horizontal transmission from the homes and the hospital environment. It is facilitated by unhygienic care practices and asepsis routines in the hospitals. Prevention of sepsis therefore must be directed towards risk factors of the respective type of sepsis. Thank you.